A very good day, my dear postgraduate students. Welcome to the topic of telepathology, R.A.T.S in pathology, racing against time for students. And this happens to be an important topic from one of the recent advances. There are other related topics such as digital pathology, digital microscopy, telepathology, etc. These shall be overlapping on each other, and in this discussion, we shall find out a way of answering these questions. A little long, but I feel that this will be highly informative. Think of the subheadings. The subheadings will take you to the answer. I start with a story and then go on with the various terminologies which are a little new to us as pathologists. As part of an introduction, we should be knowing that it is basically an image-based information. The image is chosen from a digital slide and it is transmitted over the computer networks, wherein a large number of pathologists can be seeing them from different locations. Also, the entire specimen or the whole slide can be scanned. This is the prologue I was meaning. You must be aware of the final diagnosis by Arthur Haley. It is a very famous book then and even now. There are two pathologists in a hospital and comes a biopsy from a nursing staff. One calls it benign, the other calls it malignant. So there is a dispute. Sections are sent to two different pathologists in different parts of the world. After some time, the reports come. One is benign, the other is malignant. Still, the senior pathologist sticks to his diagnosis of malignancy, gives the diagnosis, and results in an amputation, and he is finally correct, hence the term the final diagnosis. Nowadays, please be frank, is this situation probable? That is a totally different story. So this is it over here. We do think of the Codman's triangle and then the histological picture. Finally, we base it on the variants given by Ackerman and others, come to a diagnosis. Coming to telepathology. What is the definition? It is a form of communication between medical professionals that includes. It can be a transmission of image or data. It can be having different forms of clinical applications, including the primary diagnosis, rapid interpretation of cytology, interoperative, and second opinion. Also, there can be an ancillary study review. Finally, you find that it is a mode of archiving or preserving. Nowadays, we have got the slides, but the slides fade and we do not have space to preserve them. These could be preserved for n number of years. Kindly follow this image. You people may or may not have seen this, a Nikon microscope. So it is a trinocular one and an original camera with a wonderful resolution is fixed onto it. There is also an adapter that is over here that is used to adjust. You will be having an eye viewer or a vision that is possible for us to make a focus, after which the camera, it clicks, so that you get a picture of wonderful resolution that has what been seen in the earlier WHO transparencies, etc. Also, you find that nowadays the digital camera can be attached to one of the eyepieces over here or to the trinocular microscope. The history of it goes like this. It was introduced by Wetzel and Gilbertson in 1999, and they evolved the process of digital, static, and robotic microscopy. And it was in 1997 that Ferreira used the robotic method for the microscopes, operating the computers, and also handling the slides. This particular diagram will be useful to us in having the answer clear. So there is a slide collection, it is being scanned, and there is a digital imaging that is being done. Also, you find that the computers are being subject to it. As a result of which, you find that there can be high band resolutions. The images are being received by the computer, sent elsewhere, and that expert provides us the diagnosis. This can be the skeleton of the digital imaging. So you find that there are various things that is it. I gave this picture simply to show the superb quality of the Canon pictures. There is also a trick in the trade. It is not the straight picture that they are taking, but also the various adaptation and the variations in resolution that they bring about so that there is a change in the clarity, the contrast, as well as the colors. So these are the components of it. You find that these are the various components and what it is being used for. Only thing we must realize that an ordinary static camera will be of low cost, but as you go down, you find it will become expensive. It is a nice quote, but I'll be happy if you can help me find out who Confucius is. So this is the simplicity I meant. There is someone over here who is managing to screen a slide and then feed it onto a system, from wherein it goes to a server area and it is being transmitted to another place where another person studies it. And finally, the opinion or the information goes back. It need not be restricted to pathology. There is something called as telepathology. But then there is also teleradiology and teledermatology. Please do remember, this is a very important slide. There are basically three methods of digital imaging. One is called static images. Two is real time or streaming. Third one is whole slide imaging. There are three basic methods. This I would like you people to kindly remember. Now, what are the advantages of the digital slides? As I had mentioned earlier, they have the information transferred from the glass slide. They last forever, do not break, do not fade or deteriorate. Thousands of copies can be made. So, you know the importance of it. And it can teach millions of students online and offline. And also, multiple slides can be projected and compared. Static image transfer. Please look at this photograph. There is a peculiar field that has been picturized and stored. You people are very familiar with it because you are using it for your presentations, thesis work, and so on. For this, standard digital cameras are used. They are easy to use, of low cost, and it requires only a camera and a computer network. The image size is of a low bandwidth, therefore not very expensive, and the images can be archived. In the sense, they can be preserved and retrieved whenever wanted. Static image transfer features and the limitations. In this case, it is a whole slide from which a static image has been taken. Look at this one. There are multiple fields that have been photographed, of which some are being selected. And actually, even you will be having a control over it so that you can choose a particular slide or a particular field and enlarge it and then visualize. This is what we people do in conferences or in slide discussions from the Tata Memorial and other centers. But even here, you find that only a limited portion of the specimen or slide will be photographed. The remote observers will be able to see only what is being projected. This is good for teaching, but not for diagnosis because there can be a bias. It can be okay in simple cases, but not in complex cases, as we shall be seeing. Also, the grading and the cap protocol are not possible. Capsule, invasion, mitotic figures, etc. Short digital videos can be better in this case. So this is the camera that I had been mentioning. So you find that there is a viewer over here from which you can view the image that is being focused from the microscope. And finally, there is a click and the image also will be coming over here so that when you make the adjustment, this becomes sharper, just as you are using the fine adjustment in your microscope. Also, look at this one. So there is a series of these objectives and lenses. And ultimately, you find that there is a photographic piece that picks up the pictures and transfers it to the camera. Surprisingly, small is big and big is small. What do I mean? When you take a picture of a huge scenery, you find that it is confined to the camera. Also, when you take a picture of a small focus in a slide, you find that it can be zoomed so that it occupies the entire screen. Small is big and big is small. So this is just a picture to show that infrared has been used to improve the resolution and the color changes. Courtesy is Rohit Bhargava. There are the various techniques as I had been mentioning. So it can be used to capture the images, sending it to diverse locations, and whole slide imaging is also possible. High resolution is there. Good. First, we had seen the static slide. The next one is real-time transmission. Real-time means something is going on, an ongoing process. It can be a conference, it can be a discussion, and the process is going on. This solves many of the problems that is there in the digital imaging for static images. But it is expensive. The specimen imaged by the camera, it is attached to the microscope. And there has to be a continuous updation of this. It is locally or remotely controlled by a robot so that the field can be changed and there can be, for example, when you send a slide to an expert, he can change the field and the others can have a look at it. He takes the control over it. The entire slide can be visualized, but it is cumbersome. Large areas are covered, but high resolution is needed and highly expensive. So it is as simple as this. So there is an image that is being captured and he gives the instructions, it goes on to another person. Finally, they give an opinion and sometimes it can be visualized from the theater also so that they have an idea of it. So this is the advantage of the digital imaging. It solves the problem of static image transfer. Costlier. There has to be a camera at the originating site. So if I do take the pictures, it should be from my site only. And also you find that the microscope is locally or remotely controlled by a robotic interface. There can be a change in the focus or the magnification. The entire slide can be visualized, but this does not happen in a static imaging. So these are the various components that are required for it. So there is something called as WebEx for video conferencing or screen sharing. Even a frozen section can be discussed and reported. The receiver views only selected images. This can be a disadvantage. It does not get a complete picture that we are seeing on the slide. And the communication is possible for a change in the field, but that will be consuming time. Always you find that the pictures taken or given as samples in any of the camera catalogs are superb. Look at the school picture from Nikon. You find that the resolution is amazing and the details can be picked up, the nucleus and even up to the nucleolar and the ciliary level. And obviously you find that this will be worth its weight in gold. Now, for a whole slide imaging, there are two components which are needed. One is the hardware. I have mentioned this even in my class on flow cytometry. You find that there will be the microscope, lenses, the light source, the robotics to load and to remove the slides, the camera to capture, and the computer. Until this, it will be the hardware. After which, for manipulation, for managing and viewing the digital slides, there will have to be the software. This will automatically make the changes, change in the resolution, change in the color, etc. Finally send the pictures. This is the software part of it. So this is over here. Again, the components are mentioned. I would like you people to kindly go through it. For example, here the monitor. It is able to balance the color, resolve, and change the size also. The next comes the whole slide imaging. Whole slide is, this is a section over here, and it is being divided into multiple components, and the entire slide is being focused and picturized. Finally, you can choose what picture you people can like. So the pathology specimens are scanned in a high resolution digital images and are created for transmission. This image can be in an area of interest. For example, when there is a variant in a malignancy from the glandular to the papillary and areas of capsular invasion, etc. The whole slide definitely needs to be scanned. We all know the importance of it. And this is how it is. So when it is being scanned, I get multiple pictures of it and different pictures are being taken. And look at it, it is amazing. There are different fields and the image that I get in different fields are totally different. There is a glandular component which is totally missing over here. I am seeing them as individual cells. And there can be some other areas of hyalinization or fibrinoid necrosis. And this is a summary. I would like you people to kindly memorize this particular slide. Now, what is the absolute use of telepathology? Faster diagnosis, patients can be in remote rural areas. The pathologist there can take the picture and send it to a main center. Travel to the particular center is avoided. Delay can be fatal and this again can be circumvented or avoided, which is not uncommon in the traditional systems. We send it to a different place and then we get it after some time, etc. So there can be a technical variation. This is a little complex, but then just see what is happening over here. So this is a slide in which the tissue is over here. The various components such as the size, the design, the intensity are all being taken into. And finally, the area that is being focused is being picturized. And there are different features of it which could be studied, which gives an image which can be in the graphic form also for them to study. Whereas this is also a variation, but it is based on the biology, the technology, and the pathology. So here there is a stromal element, here there is an epithelium, and here there is a breast tissue. So they are all totally different. And also you find that there can be different types of cells for which the processing can be different. And any particular element can be taken and it is being studied for the anatomy. So there can be variation according to the biology of the tissue, according to the technology by which it is being studied, and according to the pathological variation in the slide. Now, what are the problems are? Within the healthcare system itself, you find intraoperative, that can be a frozen section. Rapid cytological assessment can be made. Between the center and the satellite locations, it can be used. Avoiding travel and optimizing staff. But between the healthcare systems, what happens? You can get consultation from remote persons. Even from the US or UK, you can get a opinion. Open to the subspecialist. Subspecialist literally means super specialist, a nephrologist or a neuropathologist. Eliminates the geographic distance, saves time, and it retains the tissue with the consulting institutions. This is the reference. And the procedural advantages, you find that there can be a contract central laboratory, which will be doing all the elements, and then it will be helping the laboratories on both sides. Technical services can be centralized or offshore. And there is dissemination and professional manipulation, which can be avoided in a case of a whole slide imaging. So this is a good picture, which I would like you people to remember. This is the basic site, maybe our laboratory, from which I am taking a picture of it, and it is fed onto a computer. There is a computer link or a satellite link through which it goes to any other part of the world where they pick up the image. It is fed onto the computer, displayed onto the screen, and then they study, give a diagnosis. So, what are the other uses of it? There can be other uses, such as it can be used in immunohistochemistry. Fish or fish, supposed to be chromatographic in situ hybridization. Also, otherwise unavailable in a given location, these can be utilized. They can be done. Quality assurance of the staining and other things and proficiency can be maintained. Professional peer review, you get the opinion of the superiors. So this is one thing that I had been meaning initially. You find whenever there is a low resolution, this is a kind of image that you get. But as you go deeper down the pyramid, you find that there is a higher resolution. Just as you people are using the scanner, the low power and the high power, etc. Of this, you pick up the region for display. The green color is the region for display. And then there is a particular area that is chosen for the photography, and it is passed on to a slide or time. The pyramid is chosen for the resolution. The various uses are, it is even for a patient consultation. This factor we have not been aware of. Sometimes when you want to get a consent and other things from a patient, this can be used. Sharing pathology images, and in also giving the patient an access. Nowadays we are giving duplicate slides, but this can be done by means of the imaging itself. Look at this, the final thoughts in telepathology. Somebody is studying it, then they are able to come to a conclusion. Also, there can be a point-to-point static telepathology. So here I find that there is one particular picture, multiple pictures are being taken, and the best of these are being chosen. The applications we had mentioned earlier also, there is a repetition, you people can just go through it. Also, the clinical applications can be for all these diagnoses and so on. Whereas the non-clinical can be for purely educational purposes and for trials or research. The goals in implementation can be to keep it confidential, secure, and having an easy access. Extend the service to the remote populations. And also you are having access to the subspecialists. It enhances the efficiencies and reduces the cost. Also, it can be used for IHC and flow cytometry. Definitely, I feel that this particular slide can be memorized by you people. So the difficulty can be the installation of the software is difficult, it is complicated, time consuming. But the advantage is the analysis is easy, the machine does it, and it can be seen anywhere at any time. And these are all the various things we have already seen. Look at this, an ultimate world of it. Within this, you are able to handle everything, have any kind of a conversation, a control, choose the field, take the picture, etc. This particular slide I just projected because not only is the illumination from the microscope, but then there are external sources that are providing the illumination to make that particular field bright enough for the camera to capture. The other details also can be there regarding the name of the hospital, the patient's number, etc. All this can be in this one stored and they can be retrieved at a later date. The reference ranges, what are all the brief clinical history and so on. This we have already seen. This is an important slide in which case. What is the problem with one? When I take a static image, look at this one. Look at the change between this, and this. So this is almost a normal tissue, I believe. Here there is a lipidic one, probably a bronchoalveolar carcinoma also. Whereas in this case, there are multiple projections or papillary processes which could be made out more prominent over here, micropapillary. Whereas in this case, it becomes solid. What I'm trying to say is when a picture is taken from this field and this field, they are totally different. And when I send it to two different people, there will be different diagnosis, obviously. So what are the disadvantages of the digital pathology as such? The human brain, it is equal to multiple computers. All said and done, it is analyzing, it is studying it, and you are literally feeling the slide rather than seeing the slide. The images that you see in the microscope are much sharper than what is captured by the digit. And the pathologist can choose and concentrate on any particular area, and he can review it at a later date. Clinical correlation also can be obtained very easily from the same hospital. And you can also call for the earlier slides, compare them. All these advantages are not very feasible in the case of a digital pathology. This is again a wonderful diagram. If you people can follow this one diagram alone, I would be extremely happy. So you find that there is a diagnosis, clinical diagnosis that is given from the patient. After which you find that there is a management plan that is being taken. What is it going to be used for? Is it going to be for the sake of the treatment, etc.? And finally, you find that, or is it going to be for a remote diagnosis? Or is it going to be for a telepathology? Telepathology means all that we had said earlier will have to be taken. And after that, again, you will be obtaining the data which are being integrated. And these are again being provided back to the clinical system so that they can work out the prognostic features, the pathway of analysis, etc. Also, at the other end, I find that material can be stored for teaching and for scientific publications, conferences, etc. This is a superb slide that will be giving you an entire summary of digital pathology. All said and done, as I had mentioned, what is behind the eyes matters most. Sometimes the first aid is the last aid. What I'm trying to say, this nice gentleman over here, he seems to be highly well informed, relaxed, studies the slide, gives the information. But then he will also be having a collection of the information as such. He is not only providing us the details, but he is also accumulating the details as such. This could be advantageous or disadvantageous to the center that refers it to a higher center. So these are some of my references, which I would like you people to kindly go through. So my dear students, having said all this, what are the obstacles in implementation? Always anything we will have to define what are the modes, the advantages, usage, etc. And finally, the obstacles also. In this case, we must realize that it is purely a technical issue for which you need robust instrumentation at both ends. Where you take the photograph, where I receive. Also, a good set of IT personnel and infrastructure will be needed. The cost of the equipment should be taken into account. Higher the resolution, higher will be the cost. And for real-time pictures, you find that the cost can be exorbitant. Finally, what is the control for all this? If it is being done by a technical person, he will not be aware of even hematoxylin and eosin colors. And what is the data that is going to be transmitted, stored? There are security reasons also. As I mentioned earlier, if a VIP is going to have a suspicion of malignancy, how correct will I be to send the slide to different countries? You find that the larger the file size, the slower will be the process. And hence, there has to be a very judicious use of this. The video streaming will be requiring quite a large size. All this will have to be taken into account. Also, you find that you will not be able to have a complete picture of all this. As I mentioned earlier, it is governed by the local governments on either side from which I should get the permission or clearance whatsoever. These are the obstacles in implementation which you people shall definitely note down and write. This is again a summary of the entire thing. A lesion is over here and you find that multiple fields are being picturized and you choose whatever is most representative or you deem it to be so and you send it to the consultant. This is another picture. You must be aware of the pentahead and the decahead microscopes wherein all the pathologists at a center throw their ideas. Simultaneously, you find that it could be connected digitally so that the picture is sent elsewhere and an nth person is also be able to give his expert opinion so that the entire team can be benefiting. Also for conferencing and for questioning, this could be useful. Having said all that, this is our age-old method. You find that there is one person seeing, the others seeing along with him. So there is some kind of a kindling of the mind. There is an observation and an appreciation of the same. So that this, I feel, will stand the test of time and can be still superior because, as I had mentioned earlier, behind your eyes is something that is gathering and analyzing all the information. Thank you.